Hello everyone, welcome to EAT Tech Talk. My name is Narala Siddhartha. My roll number is 20951A6744. My branch is Computer Science Engineering with Data Science as specialization. So my subject is Natural Language Processing. Today I am going to discuss about the application of machine learning and word embeddings in the classification of cancer diagnosis using patient anamnesis. So let's start this session. So I mainly divided the content into three parts. In the first part, I'm going to get and give an introduction and a basic idea about the topic that we are going to discuss. In the second part, I'm going to discuss about the methodology, and whereas in the third part, I'm going to draw the conclusions from all the content that I have explained before. I will be explaining. So let's start. Introduction. Currently, one of the main challenges for information system in healthcare is focused on support for health professionals regarding disease classifications. This work presents an innovative method for a recommendation system for the diagnosis of breast cancer using patient medical histories. In this proposal, techniques of natural language processing (NLP) were implemented on real datasets. One comprised 165 medical histories of anonymous patients from a hospital in Chile for the following categories. Those are breast cancer, cysts and nodules, other cancers, breast cancer surgeries, and other diagnoses. And the other datasets was obtained from the MIMIC3 dataset. With the application of word embedding techniques such as the word to vector, skipgram, and BERT, and machine learning techniques, a recommendation system as a tool to support the physician's decision making was implemented. The obtained results demonstrate word embeddings can define a good quality recommendation system. The results of 20 experiments with five-fold across validation for anamnesis written in Spanish yielded an F1 of 0.980 plus or minus 0.0014 on the classification of cancer versus not cancer, and 0.986 plus or minus with an error of 0.0014 for breast cancer versus other cancer. Similar results were obtained with the MIMIC3 dataset. Currently, one of the greatest challenges for information systems in healthcare is focused on helping clinicians in disease classification through the proposal of diagnosis through anamnesis. Different clinical registration systems are used as disease classifiers, the most common being the International Disease Classification of Diseases version 1.1, SNOMED CT2, and International Classification of Primary Care, so ICPC. However, the codification process is not trivial, and these classifications do not adequately represent the needs expressed by the clinicians, given that today IDC-10 has more than 69,000 types of diagnosis and approximately 72,000 procedures. This large number of classes poses difficult choices in medical systems, leading to omitted or misguided diagnosis. For instance, in Chile, according to the statistics maintained by the Ministry of Health (MinSal) in 2017, approximately 50% of diagnoses admitted to emergency care were classified as other. This problem may occur as a result of heavy workloads or because clinicians cannot find a satisfactory diagnosis within the internationally accepted ICD classification adopted by the Ministry of Health. To help with this task, two lines of development have been used. The first are those methods based on medical this this work is licensed under a Creative Commons Attribution 4.0 license. The second line of development uses supervised machine learning algorithm to analyze word frequency and to compare the results in ICD-10. In the healthcare area, natural language processing (NLP) has a great number of potential uses, among which multiple examples of applications through the use of machine learning can be found. Within the process of question and response on the web, there are instances of opinion and experience analysis concerning medical treatment or drugs, studies of clinical trials, relationships between symptoms versus lifestyle, and the efficiency of the treatment, positive and negative effects of the treatment, and information about patient's health and psychological state. In this context, NLP, natural language processing, is used to investigate and implement computational mechanisms for communication between people and computers through the use of natural language, applying techniques corresponding to models of word, phrase, or document representation. Documents or sentences are represented using two main methods. The first is based on word frequency such as TF-IDF or TF-RFL, and the second involves vectorization models, also referred to as word embeddings. The latter method corresponds to a set of techniques where words or phrases are linked to vectors of real numbers. So let's discuss about the method. The anamnesis or medical history of a patient contains a description of the doctor's interview and analysis of the patient based on their symptoms and medical evaluation. The anamnesis serves to derive a hypothesis by attending physician before a possible pathology or disease is confirmed. Depending on the extent of the clinical domain, the number of hypotheses can vary from a few to thousands, which makes it difficult to diagnose diseases that require early attention because much of the analysis that the physician performs is in the record of this medical history. It presents an opportunity for review. With the help of NLP techniques and ML, a system of diagnosis recommendations can be generated. Also, a tool to support the decision making of the physician is also created, which helps in defining the accurate and the more precise disease with respect to the existing symptoms. So, the use of coding systems such as ICD-10 provides a tool to support the registration and decision making of medical diagnosis. However, although the coding systems have significant advantages as shown, there are also analyses that address issues that doctors have encountered due to the large number of codes contained within these classification systems. These cases show errors in diagnosis or omission of up to 70%. Due to this, the necessary to help physicians with recommendation system for diagnosis and medical classification arises. Therefore, the use of machine learning model has been proposed as a support tool in the classification of diagnosis. Most of the classification techniques that have implemented machine learning in the medical diagnostic process have been centered on the use of quantitative data applied to medical exams and clinical samples. In most of these approaches, algorithms such as naive Bayes, artificial neural networks, CART, and decision trees are used. The quantitative data that are used to model the clinical histories have been mainly focused on the clinical characteristics of anatomy, the type of disease, medical consultations, disorders, procedures, chemistry, and drugs. To carry out this research or topic, datasets were used. The records of the clinical histories have been used, written in Spanish of the doctor and Religion Clinical Hospital in the city of Chile, which was authorized by the Hospital Ethics Committee. To conduct the experiments, we have applied the process presented. The process is based on the 7 steps of the machine learning, comprised of data collection, data preparation, model choice, model training, model evaluation, parameter tuning, the prediction process, and result evaluation. This PPT is an initial proposal for a new diagnostic recommendation system that uses clinical histories written by the medical practitioner, and it focuses on the classification of anamnesis of patients with cancer, with breast cancer being the most common case. Currently, cancer is one of the major causes of death in the population. The number of records available in the dataset that are classified with this diagnosis and the importance of its evaluation is highlighted by a previous work that reports that breast cancer is among the first five causes of cancer death, primarily affecting women. So, pre-processing of unstructured information. As mentioned, the dataset is in Spanish. The registers contain data on gender. Regarding the diagnosis classified by the clinical histories, the most significant number of cases generated occur in registries with the diagnosis of breast cancer and other cholesterols. So we also using the vector corporization in order to predict and also uh, say the accurate this is based on the symptoms. So conclusion, the results presented demonstrate the usefulness of NLP and machine learning model for the classification task, which could be convenient in recommending the systems in healthcare. Thank you.